obsessions is the cognitive component, the compulsions are the physical or the motor component. And as you know, I'm a holistic psychiatrist. This is a self-described title. What I mean by that is that I am an MD in psychiatry. I also have my fellowship in geriatric psychiatry. And I did my psychiatric residency in India as well as here. So after a lot of education, when I started working, and especially when I became a mom, I realized that what I was doing was not helping anybody. Just a gentle reminder to please mute yourself for those people that have joined recently, to keep the ambient noise low. That was my turning point. I also was suffering from a lot of health issues and looking for more natural ways of healing myself, and especially trying to take care of my kids in a more holistic fashion is really the impetus or the turning point for me to question what I was doing, because at one point in time the way I was living my life at home and what I was doing at work were very, very opposite, and I could not live in this kind of a double life anymore. And when I started asking these questions, I realized the lack of a better word, the corruption that is in modern medicine, especially in modern psychiatry. And especially now, I mean, all of this happened 15 years ago for me, and I've had my journey. Now, even more openly, people acknowledge that there is no chemical imbalance causing these illnesses, that there is, the concept metabolic psychiatry has come up, which basically means that mental illnesses have a metabolic or physical origin. But still, even now in the mainstream, you still see only one option offered as first line, which is psychiatric medications. Catherine, do you have a question?
No.
Oh, I thought I heard you say something. If you don't have a question, then please go ahead and mute yourself. Okay. So then that was a little bit about my journey. And as I began to heal myself, and I started to attend functional medicine conferences, integrative and holistic medicine conferences, and I completely learned a new system of not just for mental illness, but also for all other, of really regarding the whole mind, body, spirit system as one unit, rather than looking at all these different organs as different silos. Next slide, Rochelle. So I do want to start by talking about patients, real patients in my practice. And for today, I have gathered these two patient stories. One of them, the next slide, Rochelle. So this young woman, she came in with a diagnosis of schizophrenia and OCD, and I worked with her in 2020. And as I applied the same framework that I use today, of course, she was told that it was chemical imbalance. She had been hospitalized at least once, if not twice. My recollection is a little sketchy right now. And she was told that she was going to be sick for the rest of her life, and she should be resigned to it. She will be on medications for the rest of her life. She had 2 kids. She was a young mom. She wanted to have one more child, and she was advised not to have children because she was going to pass on her dirty genes to the next generation. This is how I found her. And her OCD was all to do about her mothering. She really, being a mother was a strong identity for her. And after hearing some of these things, that she was an unfit mother, that really fed into her OCD, to the point where she thought that CPS was going to come and take her kids away because she's not good enough mother. So her obsessions and compulsions were really about checking to make sure that she was doing everything that she needed to do as a parent. And this was, and at times she would lose insight into that. For many times she thought that she knew that it was senseless, that she was able to reassure herself, but that was temporary, and she would sometimes go into psychosis as well. That's where the diagnosis of schizophrenia also came in. But when I started to apply the root cause approach, really what we found is that she had severe inflammation, which was very visible. She had significant acne rosacea, on her, right there on her face. She had Hashimoto's thyroiditis. She had hormonal imbalance. She never had menstrual irregularities before, but when she was in the middle of this inflammation cascade, even her periods became irregular. When they would come, she would have heavy bleeding, and she would have severe pain. And she and her husband were trying to get pregnant, but she was not getting pregnant. But that is the body's intelligence. Her body was not ready to bring and care for a new life. So that's what happened. So when she worked with us, I went through the same format that I'm going to share with you all today. And as part of this format, there was only one comprehensive treatment that took care of everything: the inflammation in the skin, her hormonal imbalances, the thyroid autoimmunity, as well as her OCD, and even the psychosis. So I thought that I might have to send her for OCD exposure and response prevention treatment. She did not need that at all. Literally within 2 months of following some of the steps that I gave her, which did not include psychiatric medications. It's about bringing the body, mind, and spirit into balance. Within 2 months, her obsessions and compulsions had come down to very minimal levels. And then we continued with the healing process, and I was able to discharge her from my care. And I receive a letter from her on a regular basis for the past 5 years, at least once a year. And she is doing really well. She's had 2 more babies, so she's taking care of 4 kids. She cooks, she raises her own food. She really loves her role as being a mother. I mean, she's not a caretaker, she's not a caregiver. She is a mother. She loves mothering her children who are at different ages now. She's an active member in her church, and she and her husband. She's a stay-at-home mom, but she actually put together. She's a writer. She loves putting her thoughts down, and she's writing all her recipes. And about a year or 2 after she discharged from my care, she reached out to me, gave me her whole recipe book, and said, I need you to write your book, and here are the recipes. I want you to take them and publish it. And I said, I will write my book, but I'm not going to take your book away. She will be doing it as a companion thing. So, she went from being told that she will be sick for life, she'll be on medications for life, and, it's to everything that she's doing right now. And I want all of you to know that this is not, when I discuss this with my psychiatry colleagues, they will always say that these are anecdotal. No, this happens literally with every single patient that I work with. No, of course, my success rate is not 100%. That doesn't happen to anybody. And as I tell with everyone that I work with, it's easy. My job is actually easy. It's to fix the body. You do what I tell you, your body will heal itself. Most people struggle with the psychological, emotional, and the spiritual aspect. That's what keeps them stuck in illness versus in well-being. And that's the part that I want to focus on today, because, like I said, getting your body back into balance, healing the inflammation, the degeneration, triggering repair and regeneration, it's actually really simple to do, and it doesn't take long. Next slide, Rochelle. So this next gentleman is he came in with a diagnosis of depression, anxiety, but he actually had OCD, but also and this his testimonial is available on YouTube. Maybe in our follow-up emails, I will share this testimonial link as well. So what he was struggling with: anxiety, depression, no psychosis, severe OCD, and very brilliant man, but was stuck in life, and he was diagnosed with ADHD, ADD as well. So when I diagnosed him with OCD, it was actually my very first year working independently in my holistic practice. So the first thing that we did is I recommended that he go for ERP. Now I wouldn't do that in that manner. At that point in time, one of the big reasons for that was also because he was not, I mean, I was very new. Literally, I had quit my job and he was my very first patient in my practice. So I think, so there was a little bit of skepticism on his part, and so he decided to do the ERP first. But before doing ERP, or in between that, he also went for a 10-day Vipassana meditation retreat, and he came back feeling that he was ready to work with me. So the ERP did help him, but they did put him on medications like Topiramax and SSRIs and things like that. And again, the message that he received was that this is going to be something that is going to be continuing, and he will have to be on these medications, or he will have to be monitoring himself, things like that, for his OCD. That was the message that he was given. But when, again, his presentation, his root causes were completely different. He did have inflammation, but there was a lot of trauma in this gentleman's life, going back to his childhood. He also had methylation gene polymorphisms, which was impairing his ability to synthesize neurotransmitters as well as detox from all the toxins that he was exposed to. And he was given certain medications, which I did not. It was a antiviral medication, but I did not think that he needed that. And again, those kinds of recommendations were being made to him from a fear perspective. It was a preventative. He did not really need it. And so all of this was interfering with his microbiome as well. And he was obese, he had eczema, he had asthma, in addition to the OCD and the depression and the ADD. And he worked with me intensely for about 6 months, 6 to 12 months. And in that period of time, all of these conditions, again, it was just one treatment. He lost weight, he went down to a normal weight, eczema went away, his asthma went away, and his ADD also went away. He was in a dead-end job as a manager for Starbucks. He quit that. He was able to go into Rochelle, where something's going on here. He actually found a job with a bank, and he was able to climb up in this position and able to move out of his parents' basement, buy a home with his partner, and settle down. Or, I mean, I don't want to use the word settle down, but he was able to create a life of his choosing. And the last time I met with him was when he came with his partner to invite me for his wedding. So this is possible. And before he came to me, this gentleman had been in treatment for 17 years. From the time that he was 16 or 17, he had been on and off medications, on and off psychotherapy. So these are not, this was not in the beginning of their psychiatric career, so to speak. And despite so many years being passed and having so many, ERP is exposure and behavior therapies that is offered for OCD. Basically what is done is that, now, like I said, back in the day, I may have recommended it. Now I don't, at least not in the beginning. In ERP, what we do, let's say a person has come in with obsessions of cleanliness and their hand washing. So we make them expose themselves to the obsessive thought, which is that their hands are dirty. So we'll get them to, touch. Actually, I mean, in the OCD clinic at the hospital I was working at, we would actually get these people to touch the toilet seat. I mean, not a dirty toilet still, but that would be enough for the person to feel very anxious that their hands are dirty, all the germs. And then we tell them to not wash their hands. So that is the exposure to the thought and response prevention. So when the obsession happens, they want to wash their hands, which is the compulsion. So the idea is that you expose yourself, anxiety increases, but you don't give in to the compulsion, and you face the anxiety Eventually, the anxiety goes down and the fear of dirty hands goes down. But today's lens, I see this as almost like torture. Because OCD is not just a whim. The person is not having these obsessions and these compulsions for fun. They're not doing it intentionally. It's a whole different way of understanding the root causes. There are biological root causes, mainly inflammation. And when it comes to genetic polymorphisms, I have not found research to support this, but my clinical experience has been many of these patients have MTHFR gene polymorphism, but they also have COMT polymorphism. I began to see that show up, especially in OCD patients. And both of them, if you have MTHFR gene polymorphism, you're not metabolizing folate, you're not making enough detox molecules so you hold on to toxins. And COMT, you're not able to metabolize or use a nutrient known as methionine, which is a very important methyl donor. This is going into biochemistry, but basically COMT indirectly controls the turning on and turning off of different genes, whether it is for insulin production, synthesis of neurotransmitters. It basically acts as a controller switch to turn on and turn off the genes. So, but when you have these kinds of polymorphisms, it can show up in the body as these various diseases, and it can show up in the mind as these illnesses. So getting somebody with these polymorphisms or with inflammation, gut issues, microbiome disturbances, hormonal imbalances, to then tell them that they need to do ERP does not make sense. And over the years, what I've found is that when we address the root causes, OCD symptoms actually go away. And I can talk about this from a purely biological perspective. So like I said, when we treat the COMT polymorphism, I have seen clinically OCD symptoms come down significantly. Secondly, I can talk about it from a psycho-emotional spiritual perspective. OCD then is, in majority of the patients, it's a need for control or a need for the just rightness. And in many of these patients, that comes from early life trauma, where they experienced significant loss of control in their immediate life. And these are compensatory mechanisms that the ego puts in place so that people can experience a certain measure of safety and security. So, and spiritually also I can explain these kinds of symptoms, I mean any symptom for that matter, whether it's medical symptom or a psychiatric symptom, from a spiritual standpoint, is really an expression of our amnesia about our divinity. We forget we are divine, we forget we are whole, we forget we are part of this whole nature. So, next slide, Rochelle. So with that, I want to step into the root causes. And this idea, and of course I'm sharing all of this because I want all of you to connect with the fact that if healing can happen in somebody with severe OCD and psychosis, and somebody with severe OCD without psychosis, then it can happen with you as well. Next slide. So I want you all to really consider this question, which is, what does it actually mean to be healthy? I just want you guys to sit with that. What does it actually mean to be healthy? And if you want to, you can share it in the chat function. But really, I'll just give you a minute to sit with that, because this is where I want you to start envisioning. Okay. Oh, somebody from YouTube said that they are homozygous MTHFR and COMT. So if you're on YouTube, and thank you for sharing that. Again, just a reminder that this is a public forum. But with these genetic polymorphisms, it's all about epigenetics. It's not that anybody is, yes, health means balance and ease. Thank you, Casey. The polymorphisms simply indicate specific biochemical nutrient needs. And when we provide those needs, then your cellular metabolism will actually normalize within days, if not weeks. It doesn't get any more simpler than that. But I don't want people to fall into the idea, if I'm giving this idea that, oh, it's all just a genetic polymorphism and you just have to take these supplements and you'll be fine. No, it does not work like that. It's always a combination of factors because we are complex beings. It's not one thing that breaks us down. When we break down, it's because there was things accumulating and something became the last straw. So Casey said health is balance and ease. Yes, I agree with that. Now, I do want to share what Ayurvedic definition of health is. So Ayurveda defines health as balance in the doshas, which is the bioenergies that animate all of us. That sama means balance, so sama dosha, sama agni, balanced digestive fire. Agni refers to the digestive fire. Sama dhatu, dhatu refers to all of the tissues that make up our body. So in Western medicine, we have one way of organizing the body, like, the heart, the lungs, these are all the different tissues. In Ayurveda, it's more of an abstract concept. It starts off, there are 7 tissues, and it starts off with plasma being the first tissue and ends with shukra, which is the reproductive tissue. So it's a different way of, and when we nourish and when we are healthy and when we are receiving nourishment, it first nourishes the plasma, then rakta, which is blood, then it goes on like that, and it is the reproductive tissue that is nourished last. And when disease happens, the first thing to lose is our fertility before it shows up in the blood or in the plasma. So that's why many people with chronic illnesses, fertility goes down. That's why we are seeing a rise in infertility in the world. Both male and female infertility is on the rise because that's the first thing that goes away. And when in treatment, that's the last thing to come back. But in treatment, in Ayurvedic lens, we are actually addressing each and every one of these 7 tissues. So samadhatu, malakriya. Malakriya is the excretory processes. Mala means excretion and kriya is action. So any of the excretory activities, they're also in balance. And then prasanna means happiness or pleasantness. Atma is our soul. Indriya, senses. Mana, mind. So it's not just about our energy being balanced, the digestive fire, the tissues and the excretory processes, but our soul, our sense organs, and mind have to be in a state of pleasantness, even bliss. Such a person is considered as swastha. Next slide, Rochelle. Swastha means health. But if you actually look at, we can go to the next slide as well. If we look at the word swastha, which is the word for health in Sanskrit, it's a composite word. Swa means self. Stha comes from sthir. Sthir means stable or rooted. So health is about balance. It is about ease. It is about all of these functioning happening in a balanced way. But fundamentally, a healthy person is one who is rooted in themselves. So which means that they're living a life in alignment with who they are. And that's why I said, it's easy to heal the body, but until and unless we figure out how to be in that soul alignment with who we truly are on the inside, until and unless we get there, that healing can feel a little elusive. And when it comes to that part, I can show you the way. And I've been through this process. Like some of you have known me for years now. The person I was there is not the same person that I am today because of this evolution that has happened inside of me as well. I can show you the way, but it is your journey. That's where the outcomes can vary. All right. So, but my job here is to show you some of the tricks and tips that I can give you. So what is needed to make this a reality for you? Feel free to drop it in the chat. Next slide, Rochelle. So how do we make this a reality? We first need to understand what is the landscape. And in all my years of working as a holistic psychiatrist, I have seen the same pattern over and over and over again. No matter what your presenting symptom is, no matter whether you are a young kid or an older adult, it does not matter. It falls, from my perspective, this is when I look at all of the root causes, it falls into these three categories. Number one, diet and lifestyle. Number two is trauma. Number three is toxins. So diet and lifestyle, I like to think of it as the choices that we make on a day-to-day basis with regard to what we are eating, what kind of products we are using, how we are sleeping, how much we are moving. It's all about our choices. Trauma is all about our relationship to ourselves. It's that inner chatter that we have. How do we talk to ourselves? It's that background chatter. Are we kind? Are we compassionate? Are we the critical person, which most of us unfortunately are? And that's the process of unconsciousness. So trauma is really about our relationship to ourselves. And the truth is, most of us will never talk to another human being in the way that we talk to ourselves. And that is where we experience the most imbalance in the cortisol. It's corrosive to the body and corrosive to our soul. Again, that's where, the trauma healing is not just about the mind. It's not even at all about positive thinking. It does include spiritual concepts of surrender, acceptance, self-love. All of these things come into play, but also creating with the body safety and security in our body, in our heart especially, in our nervous system, and in our life. Now, if you are in an unsafe situation, for instance, if you're living in a home that is moldy, you have to get out of there. So this is not blindly asking you to, if you're in an abusive relationship, you have to take stock of the abuse, and charity begins at home. You have to create that safety externally and internally. So outside of those kinds of situations where the lack of safety and the insecurity is coming from our chatter in the mind, that is very much an internal work. And of course, thirdly, toxins, environmental toxins. Mold is a big one. Vaccines are a big one. So in working with children with OCD, some of them, up to, I think it's 5 to 25% of children with OCD get diagnosed with PANS and PANDAS. And not everyone will actually have that classical streptococcal infection and suddenly the next day they're having these problems. No. Sometimes there is no infection, but they may have the antibodies, so it can be a subclinical infection. But one of the patients with very severe OCD, and eventually she went into psychosis, is a 14-year-old kid that I'm working with who developed severe sudden OCD, like it's exactly how it is described in PANS and PANDAS. 3 days after she got the second dose of COVID vaccine. 3 days. So the PANS and so that's why even the PANS and PANDAS, I like to look at it in this, and in this framework of diet, trauma, toxins. And when I do that, the pattern that I actually observed is not only an association of this OCD with infections, but if you dig deep, an association with other childhood vaccines. So basically what happens is that when our immune system gets triggered in a massive manner, so ordinary infections actually don't do that. They don't trigger our immune system in a massive manner. What do I mean by in a massive manner? Is that the immune system is getting triggered in multiple organs in the body at the same time. With an infection, it actually does not happen that way. With a regular infection, otherwise healthy kid. But with vaccines, because most of the vaccines are injected, they go into our capillaries, and when it goes into the capillaries, it's going into the plasma, in the interstitial fluid, and eventually it enters into the bloodstream, and it enters into the bloodstream. Every 5 minutes, our blood is recirculated. So whatever's in the vaccine has the potential to reach end organs within 5 minutes. And wherever it goes, the immune system is everywhere. Immune system is in the brain, it's in your toe, it's everywhere. Wherever these vaccine ingredients, and the vaccine ingredients are designed to trigger our immune system. That is by design. So if it just happened in your arm, you'll just have a pain and a swelling. But if it's happening in your brain, the brain does not sense pain. When the brain is hurting, it shows up as anger, anxiety, psychosis, hearing voices, seeing things, headaches, seizures. This is how the brain expresses its pain. And swelling can also happen. Headaches can happen because of that microscopic swelling. And pans and pandas, my big fear in just looking at pans and pandas is that, let's say those antibodies are negative. Then does it mean that this OCD is chemical imbalance? No. We have to still look at all of these things. So for me, looking at the pandas, it's not just looking at the anti-streptolysin antibody titers. No, so that's where I bring in the Ayurvedic assessment as well. The way we understand inflammation in Ayurveda is based on the signs and the symptoms that the body is making. We look at the digestion. And in Ayurveda, Pitta, which is fire, shows up as pain in the body, but in the mind, it shows up as irritability. So I don't care if you have negative streptolysin antibodies. Even if your HSCRP, another non-specific marker for inflammation, if that is negative, but if you're highly irritable, that tells me you're already inflamed. And that's the way we need to look at kids with pans and pandas, as well as kids who come with this severe OCD, but whose pans and pandas panel is negative. Because we have to remember, especially in younger and younger children, their immune systems are not fully formed. They may not respond in the same way that an adult's immune system would respond to an infection, even to a chronic infection like this. So, I can go on about my thoughts with pans and pandas. In fact, when we looking for those antibodies, the ASLO, anti-streptolysin antibodies, are they really antibodies to streptococcal infection, or are they auto antibodies to other tissues? This is the role that toxins play, and it's not just vaccines. When we get exposed to toxins, whether it is pesticides or artificial fragrance, the chemicals in our soaps, shampoos, toothpaste, all of these things, one thing to remember is that they're all petrochemicals. Every single one of them comes from petroleum. And I'm not kidding. I have an article to prove my point. The title of the article is called Facts and Ideas from Everywhere, that was published in 2010 by a professor of medicine from Baylor College of Medicine. He was retired, but he had an honorary position, and he's a great writer. And so he wrote about this in 2010. Everything from your printer ink, if you're not, your sheets, your laundry detergent, everything comes from petrochemicals. And because they are petrochemicals, they are fat soluble. And because they're fat soluble, they penetrate into our tissues, because every cell in our body is made up of, the cell membranes are made up of fat. So water soluble particles require a vehicle to take them inside the cells, but fat soluble particles go directly in. They go everywhere. And again, because these molecules are not biological molecules, they're not our molecules, our immune system gets aggravated and it triggers a chronic inflammatory response. So what do I do? Next slide, Rochelle. This is again going back into the self. I think I spoke about this. Next slide. The fundamental message from this slide is that we, when it comes to our relationship to ourselves, we have to learn how to accept, surrender, and fall in love with our own self again. In fact, I call it romancing oneself. So then, what does it look like to work with me? Where are we? Okay. So, it starts with a consultation because it's we look at exactly what's going on so that we can map it based off of the framework of root causes that I shared. Labs and supplements, and really the labs that I am, Rachel, let's go on to the next slide. Okay, there you go. So there was another one. There were two things that I sent you. Oh yeah, okay, there we go. So look at the top part of this slide. This is a patient that came in with severe anxiety, not necessarily OCD, but I do want to show that post-COVID world, this is one of the things that we have to look at, because only when we know the root causes, then we can treat it. So if you look at the top part, this lady is having 384,000 units of IgG antibody and 2,400 units of IgA antibody. IgA is the secretory antibody. IgG is the main one, immunoglobulin, that's inside her, in her immune system, in the blood. And normally, after any infection, we don't make antibodies forever. And she's not had an infection in years. She actually doesn't recall actually having any COVID infection. And IgM is not positive. IgM is more typically representative of a recent infection. These are all the different types of immunoglobulins. And so then why is she having so many antibodies? What is triggering that? It means that there is circulating spike protein. Is the spike protein coming from an infection or is it coming from the vaccine? This lower part tells us what it is. So she's having so many antibodies. Even after the vaccine, we don't expect to see antibodies lasting for this long. It should actually be less than 1,000. And studies are showing that if anybody with a level over 5,000 units of antibodies, actually over 3,000, will begin to have chronic symptoms, whether it's in the body or in the mind, POTS, mast cell activation. These are all the things that we're seeing with levels just over 3,000. And this lady is having 384,000. She thought she was dying. That's how bad she felt 2 months ago. And the lower part will tell us whether it's coming from vaccine or whether it is coming from an infection. How? This lower part is looking at cellular T cell response. And she's barely having a cellular response. Cellular response happens when there is actual virus or fungus or cancer in the body. That's just how the immune system works. For bacteria, for toxins, we make mostly antibodies and a little bit of the cells. But for viruses, fungus, cancer, we have more of the cellular immune system getting activated. So from her response, the only thing that we can conclude is that she's not having this reaction to a natural infection. She's having it to the presence of circulating spike protein. And this is something that we have to start looking for anyone that is presenting with chronic inflammation in this post-COVID world. Next slide, please. And this is an indirect test. To my knowledge, so far, we don't know, or I don't know of any test that's actually looking for circulating spike protein. But that level of antibody, and this was, she sent it in early April. She's reporting 65% improvement in her overall symptoms with what we are doing now. She literally thought she was dying, but she's doing so much better. So the test was sent, I think, April 10th or 13th or something like that. So I know that number has come down, and we are continuing to help. One, I recommend augmented NAC that breaks down majority of the spike protein, which she will have to, and most people have to take it at least for 3 to 6 months. Some of them will have to take it for longer, because the spike protein is being generated by our own cells because of the genetic code that we received. That's why I keep telling people that this is a spiritual process. You have to start talking to your body, talking to your cells, and actively instruct your cells to not make the poison anymore. And that is critical. And we have to have this relationship with our own body, with our own cells, irrespective of the disease. In any disease, we can instruct our cells, our body, our tissues to start the process of healing. I think I'm done. I not to pack in too much information, but okay. Do we have anything else? Don't think. So I will open it up for questions. Let me know if you have any questions. And yeah, we do have. I have an offering here. So this is a session, an appointment with me. The regular price is $500, but for this. For being part of this here today, for the link if you're interested in taking the next step with me. We also have the other appointment, which is for $600. That is both for me. Working with me as well as with the Ayurvedic doctor, so that you get the full picture right at the beginning. And after these appointments, you will receive a comprehensive plan with everything that you should be doing. Okay? To get back onto your journey back to wellness. So I think I don't have anything else to say at this point in time, but open to any questions.
Hi, this is Casey. Thank you so much for the last hour. It was really great to hear of the success stories. How much of what you sort of recommend or in your protocol is based on food? And food versus supplements?
So fundamentally, our body is made up of food. So supplements are supplemental. But in the beginning, I find, because when people are in a state of inflammation and toxicity, what I've found is that it becomes difficult for people to make lifestyle changes. So I do recommend that people start off with especially Ayurvedic herbals, and they are not actually supplements. Ayurvedic herbs are actually medicine that acts at the level of your energy, at the level of the doshas, and it will start to detox your body. So more clarity will come in. You will begin to feel more like you. And at that point in time, this typically takes about 2 to 3 weeks for this to happen. But at that point in time, doing something like an elimination diet for 4 to 6 weeks, ideally 6 weeks, is very, very essential because we have to restore the gut lining. That is the fundamental problem in all diseases. Casey, you were saying something?
Oh, no, I was agreeing with you because I had tried to work with someone very briefly to do a whole round of supplements, and I was taking up to like 20, and I felt like it wasn't really good for me and my liver. I don't know, and I just I took myself off of all of them.
Yeah.
I am in the process of essentially tapering off of an SSRI. I had been taking SSRIs for over 20 years and it really stopped working.
Okay.
So now I'm kind of at the point of like, well, maybe I can try something more holistic.
Yeah.
So
you bring up a good point, and again, this is not a direct recommendation for you, but and I do in my practice. That's one of things that I do. I help people come off psych meds. But what happens with the psych meds when somebody is on a psych med for any length of time, the underlying root causes are never addressed. So the root causes actually are continuing; they're progressing unchecked. And the second problem is that the taking these medications will then create its own neuronal perturbation. So the process that I use in my practice is that we first address causes. And then I recommend hyperbolic tapering. Have you heard of hyperbolic tapering?
I have. Is that just throughout a very extended period of time? Okay.
Yeah, I see this. That's where, the hyperbolic tapering, what I have found is that when we bring your physiology back into balance, then really what happens is that your soul takes over. Fear comes down. And when you start tapering from that state of body and mind, it goes very well. I start off with hyperbolic tapering, but then many of my patients, then they learn what they can tolerate. For some, it becomes very, very easy. Like within 4 to 6 months, they're able to come off of the medications. But every person is different.
Okay.
So Simone has a question about tests. So that, in fact, again, tests also, I see them as supplemental. I do believe that as physicians, we really need to understand the physiology which is balance, and the imbalance simply by analyzing how different parts of the body, different organs of the body and mind are functioning. But some tests really, so I mean, in listening to this patient's story, I knew because the timeline, like she got the vaccine and then boom, 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 so many illnesses happened. I'm getting a little distracted, sorry. So, but the test, it sometimes is a confirmation of some of the findings that we find, or we are hypothesizing. So at a bare minimum, I do recommend the blood work with Function Health. I also recommend organic acid test and a mold toxicity test. But these two, again, I mean, let me say it, with all humility, I find that when we really understand the physiology, how the body and the mind function, and we can recognize the imbalance. So these two tests are important, but they are secondary. The blood work is important, which I recommend Function Health for that. So people can go directly and place an order. Even for these other two tests, that's also you can place an order. The other thing that I absolutely do recommend is actually the gene profile, the methylation DNA profile, because when I get to see that, then there can be a little bit of fine tuning with regard to the supplements, especially when it comes to how long do you need to take it, or what is it that you need to continue probably indefinitely. And if there is a suspicion of long COVID or COVID vaccine, I also recommend to do the spike protein test. So, but one thing I have to say, I have a virtual practice. I'm licensed in Wisconsin. So for anybody that is in Wisconsin, I work as your de facto physician as a medical professional. But if you're outside of Wisconsin, I'm working as a mental health coach and a consultant. So I can recommend, I can suggest, and of course I can interpret, which is what I will be doing. But you also need to have your own physician, nurse practitioner that is also laying eyes on those tests and giving you medical advice from those other channels. So this is for people outside of Wisconsin. And in today's world, you don't need a doctor to give you a lab order. You can directly go and buy these tests on your own. So in that way, it's a little bit easy. For me, that is freedom of health information. So Alina has a question. $400 is just with me, $600 is with the Ayurvedic doctor. And after that, yes, what happens is that after this session, you will get a comprehensive treatment plan with regard to diet changes, the supplements that you need to do, lifestyle changes that are important. So we hit upon all of this. But the way I'm working nowadays is really in the form of, I call them portals of transformation. Because it's not one appointment, it's not one thing. What happens in the journey is that it's a process. Your disease did not happen overnight. It built on itself, and there are multiple factors to it. So in my portals of transformation, I've actually created a sequence, and the sequence absolutely matters. Like I said, ERP, I wouldn't do it at all nowadays because I don't find the need for it. But if somebody needed ERP, that wouldn't come in the beginning. I would first fix their gut lining, address a little bit of their trauma, make sure that they have that healthy sense of self, then maybe do the ERP. So the same thing. So there is a particular sequence that I follow, because you cannot put the cart before the horse. And in fact, many people, when they experience negative outcomes from well-meaning physicians and well-meaning protocols, it's because the sequence is not done properly. There's one way that our system works, and that's why about the 70 shoes in Ayurveda, which is why I absolutely love Ayurveda and Ayurvedic philosophy and science, because they seem to have mapped it all. And so the sequence that I'm sharing actually comes from Ayurvedic medicine only. There was something else that I wanted to say here with regard to that. So for these portals of transformation, we have a 1 month portal, we have a 3 month portal, and a 6 month portal. And what is included is, I created it in this manner so that I'm able to, make it affordable and accessible for people from different walks of life. And remember, becoming healthy is a lifestyle change. It's about learning how to fall in love with yourself and then how to take care of yourself. So there's something that I wanted to say. It's just like a brain verb now. It's not coming out, but it was something to do with I don't know. Okay, and the spike protein test is not with Function Health. It's actually the one that I showed you. There's a lab in Germany, so that lab comes from Germany. So you order it online, and they will send you the kits home, and you just follow the instructions. I haven't done it myself, but ever since the COVID vaccine happened, I've been waiting for companies to come up with this. Finally, this company they opened their location in US just recently, and you'll be able to, if you go to my website in the shop page, all of these links are there. So again, this is the direct to consumer labs, so anybody can order it and see it for themselves. So you're not really getting it from with a doctor's order, but take it to your physician. If you're working with me, obviously I will look at it and give you my recommendations for all of these things. So, any other questions? Oh yeah, I remember what I wanted to say. So with regard to supplements, in fact, in Ayurveda, the importance is so much with regard to restoring the digestive fire, because even to metabolize your supplements, you need a healthy digestive file. That's why the sequence absolutely matters. The first thing that we do is restore that digestive file, because everything needs to be metabolized. That's what I wanted to. So it doesn't surprise me, Casey, when you said that you were on 20 supplements and you were not feeling well. No, because if you don't digest, if you don't metabolize, even if it's the best supplement in the world, that can become ama. In Ayurveda, we call it ama. It basically means toxin or poison. So
right. And I've had people more holistic, more spiritual saying that I had an issue with my liver. Nothing was diagnosed, so I was also worried about, am I overdoing it? Does my liver need some sort of like cleansing? I don't know. So then I got worried, and then I just took myself off of them all.
Well, that I would say that was your intuition, in fact. And anytime, and this I can give as a. I mean, I have to be careful with what I say, but
right, I know.
with because we live in a crazy world. But anybody that is having any digestive issues, so this is not a recommendation, not a clinical recommendation. A simple thing is cumin, coriander, and fennel. Get those seeds. In fact, Banyan Botanicals has them in one bag. You just take a teaspoon or a tablespoon of it, boil it in a quart of water, drink it 15 to 30 minutes before your meal, hot. And that will actually help with a lot of digestive. It's very simple. Turmeric, black pepper,
coriander. Say
it's
that again.
Sorry. CCFT. It's called the CCFT. Cumin, coriander, and fennel. And I have my ginger tea. I make ginger tea in the morning, and then I use that ginger. I keep pouring hot water into it. Not so much in spring and summer, but definitely fall and winter. This keeps digestion going. So there's so much, and every culture had this wisdom in it. So, so much of what I do is really getting people to recognize or to remember, all of this. We think of our genes as coding for organs and tissues. No, they information far beyond our body. Jung, in the psychiatry world, Carl Jung, Freud's contemporary, less well known, but I'm more of a Jungian than a Freudian psychiatrist. Jung has called it the collective unconscious. In Eastern mythology, Eastern mystical texts, we call it the Akashic records, which is, in quantum physics, the same thing as the unified field. We are surrounded by it, and we can connect to it, and we can get that information. That information is in our genes. We can tap into it. Every answer, we get it from here. And that's what, swastha is, rooted in self. I can go on, but I know everyone's got life to go back on. But I think the one message, if I were to summarize all of this, is there is nothing to fear. And we are here to experience life in its fullest extent. That's what we're here for. And our wound becomes our portal for transformation to something beyond greatness. That's the gift on the other side of your struggles. And I speak that, thank you, Casey, but that's actually my truth that I'm sharing with you guys. When I look back, but of course, when I was going through those struggles, I got fired from every position I had. And the state keeps looking into my work all the time. It'll stop. I'm not going to make it happen anymore. But when I look back, those moments where I struggled, it literally was for my metamorphosis, for my upgrade. Even the health issues that I had. I literally, back in the day, I used to curse my mom. Not curse is a strong word. I would actually call her up and how could you passed on these dirty genes to. That's the language I was using. Poor thing. She would laugh it off. I would be half joking. But only later on I realized that was the medicine. That was my gift that I could then share with everyone. Alina, yes, the best email for me would be, I'll share it, I'll put it here. Yeah, you could also reach out to my assistant. Her name is Erica, she's wonderful. This is her phone number as well. So, if you have any questions further, feel free to reach out. All right. Thank you so much, everyone. Take care. Bye.
Thank you so much. Bye-bye.